So today I spoke about the new guidelines that were released in the past year by the American Heart Association and the American Academy of Pediatrics, recommending neurodevelopmental follow-up for children with congenital heart disease. There is an increased risk in this population of developmental problems, and that certainly doesn't mean that all children with congenital heart disease will have a problem, but because there do seem to be more kids within that group than in the general population that end up having an issue, the American Heart Association and the American Academy of Pediatrics came out with recommendations for regular screening and evaluation. So at Children's, what we've done is we've started the CAN-DO program, the Cardiac Neurodevelopmental Outcomes Program. I co-direct this program with Dr. Mary D'Onofrio, who's a cardiologist there as well. And we provide regular screenings and evaluation from infancy all the way through adolescence for children with congenital heart disease as needed if they're determined to have high risk of problems. This involves several evaluations during infancy and then a couple of evaluations once they get to school age and adolescence. The American Heart Association guidelines were following the recommendations in terms of the timing of the evaluations, and we try to time the evaluations at key stress points in a child's development. Once they get to school age, that's around the time they're going to enter kindergarten, to be able to prepare them for that transition when they're going to experience increased demands on several cognitive skills, thinking skills like attention, organizing their behavior, being able to follow instructions and learn. This happens again around the transition to fourth grade and around the transition to middle school, where children are asked to do things more independently. They move from learning to read to applying those skills and doing things like reading comprehension and learning from text. So at these times, things that might have been a mild problem, maybe not causing concern before, often become an issue at those stress points. So we try to time the evaluations to catch any concerns before those stress points happen and put appropriate supports into place. If you're a parent of a child with congenital heart disease and you don't know if this program's right for you, or if you have questions about the program, I would encourage you to contact us. Our number is available on the website, and we can talk with you about your concerns or about whether the program's right for your child and make sure that if it's right for you, we get you involved.